Hello everyone and welcome back to 3 Docs Teaching. I'm Dr. Zen and today once again we'll be going through a question. So today's question asks which of the following complications is she at an increased risk for? Okay, so now when we read the stem, we're going to go through and look for clues. So a 6-year-old girl, so the age could be relevant, so I'm going to highlight that, comes for a well child visit. She was previously found to have delayed speech. Okay, delayed speech could be relevant. And IQ was found to be 68. 68 is a low, so this is a relevant point. She is at the 35th percentile for weight and the 95th percentile for height, so this disparity could also be relevant. Evaluation of her visual acuity reveals that she is legally blind in both eyes. Okay, so her visual acuity is not very good. With bilateral inferomedial displacement of the lenses, so this patient has ectopia lentis. This could be another clue. She has arachnodactyly, all right, and her arms reach her knees while standing. So arms reach her knees. Which of the following complications is she at an increased risk for? And these are our options. So let's go through and take a look at what our clues are for this question. So our first set of clues are regarding the stature or the habitus of this patient. So first off, this patient is tall and thin. This patient has long limbs and arachnodactyly. These three things together are what is known as marfanoid habitus. So our first clue is marfanoid habitus. Our second clue is that we had the ectopia lentis. So remember, the lens was downwards and inwards in this patient. So we have bilateral inferomedial lens dislocation. Our third clue was intellectual disability. Now with these three clues, we should have our diagnosis by now, which is homocystinuria. Now let's go through some of the signs and symptoms that we commonly see in homocystinuria. The first of which is something that is actually present in this patient, which is ocular anomalies. These could be things like myopia or ectopia lentis. The next thing we can see in these patients is marfanoid habitus. Then we can also have intellectual disability. There can also be cardiovascular defects in this patient. And osteoporosis as well. Now that we've gone through the signs and symptoms of this condition, what do you think the answer to this question would be? If you chose A, then you would be correct. Now let's go through each of these options and see why they would be correct or incorrect. So what's up with premature CHD? Well, firstly, you have an increased homocysteine level in this condition. That leads to an increased risk of both thrombosis and atherosclerosis. But why? Well, when it comes to thrombosis, there's actually a bunch of reasons why this could lead to thrombosis, increased homocysteine that is. And this is an area of this field which is currently still under study, so these mechanisms are not very well established, but some mechanisms that are currently being studied are things like increased tissue factor expression because of elevated homocysteine levels, and things like attenuated anticoagulation processes. So it's just something that could help you remember that increased homocysteine leads to an increased risk of thrombosis. As for atherosclerosis, there's a more well-established reason that it can cause this. What happens is that with an elevated level of homocysteine, there is an increased activity of HMG-CoA reductase. And if you remember, this will lead to increased cholesterol synthesis. And that can lead to atherosclerosis. Now let's move on to cataracts. Why is cataracts one of these options? Well, the reason they put cataracts in here is to confuse you between this condition and galactokinase, which is actually kind of weird because galactokinase doesn't really present like this at all. Its sole manifestation is usually just cataracts. So this is relatively an easy option to rule out when you're going through the questions. Next up, we have aortic abdominal aneurysm. So this is actually probably a little bit more tricky to rule out because the reason they put this in here is to confuse you with Marfan syndrome. And this is one of the differentials that people often confuse with homocystinuria. So the way to differentiate that this isn't in fact Marfan syndrome and this is homocystinuria would be number one, Marfan's doesn't have intellectual disability. And number two, Marfan's has superotemporal lens dislocation rather than inferomedial. So the lenses will be dislocated in this kind of fashion rather than what we saw with homocystinuria, which was somewhere here, inferomedially. Next up is self-mutilation. So what's this confusing you with? This should confuse you with Lesch-Nyhan syndrome because that is the condition that presents with self-mutilation. The thing about Lesch-Nyhan is that it does in fact cause intellectual disability. But the way to differentiate that this case isn't Lesch-Nyhan is number one, the fact that Lesch-Nyhan is mostly, in fact almost always, in boys. Why? Because it's X-linked recessive. And number two, Lesch-Nyhan does not have any marfanoid habitus or ectopia lentis. So these things, you won't see them in Lesch-Nyhan syndrome. Finally, we have intestinal ganglioneuromas, and the reason that this could confuse some people is because this you will see in multiple endocrine neoplasia type 2B. And the thing about this is that it can cause marfanoid habitus. But the differentiating part will be that there will be no intellectual disability here. And also, no lens dislocation. And with that, we have covered our question. So the reason it was A is because there's an increased risk of thrombosis and atherosclerosis, which would both lead to premature CHD. Now, cataracts, it's not cataracts because this isn't galactokinase deficiency. It's not ascending aortic aneurysm because this is not Marfan syndrome. It's not self-mutilation because this isn't Lesch-Nyhan syndrome. And it's not intestinal ganglioneuromas because this is not MEN2B. And now you know how to differentiate all these different conditions from each other. And we are done. So I'll see you all next time for the next video, and if you have any requests for any topic or any question that you found difficult, put it down in the comments and we'll be sure to address it. See you next time.